Welcome. My name is Rebecca Preza, and I'm the Healthcare Facilitator at UCSB. In this video, I will be covering the transition to UC retiree health insurance. This video is geared towards UCSB faculty, staff, and academic employees who are in the process of retiring or considering retirement in the next 5 years. Here's a brief look at the chapters I will cover in this video. If there's a specific chapter you'd like to jump ahead to, you may do so by hovering over the timeline of this video and clicking to the chapter of your choice. So of course, with each of these presentations, I do have to provide a little disclaimer. This presentation is intended for communication purposes only, and it is not a guarantee of benefits. You can find additional information about the UC policies and the health plans on UCNet. Now let's talk about the future of retiree health. The University of California is committed to ongoing health benefits for retirees. However, it is not a guaranteed benefit. That means that the plan designs can change, and that means your share of costs may increase year over year. I like to share resources in the beginning to help assure folks that they are not alone in this process. Once you understand where you need to go and what you can do will make you feel better equipped through your transition. The Retirement Administration Service Center, RASC, is the administrator and system of record for UC retiree updates and changes. RASC will remain your primary point of contact during your transition to retirement and retiree health insurance, as well as after you retire. The best way to research, update information, or contact RASC would be through your UC Raise account. If you have not yet set up your UC Raise account, I strongly encourage you to do so. UCNet will continue to house all UC plan-related documents, including plan contacts, booklets, and summaries, and upcoming open enrollment changes. The Social Security Administration is where you will go to apply for Medicare and Social Security benefits, whereas the Medicare website is where you will find all things related to Medicare costs and coverage. Lastly, the Health Insurance Counseling and Advocacy Program, HICAP, is an excellent resource for UC retirees and or their family members who may not be eligible for UC retiree health insurance. HICAP offers free and objective information and assistance to folks who are transitioning to Medicare. Let's take a look at eligibility. In order to be eligible for UC retiree health insurance, you must be enrolled or eligible to be enrolled in UC employee health coverage at retirement. You must elect a monthly retirement income. You have 10 or more years of UCRP service credit. You elect to continue your coverage, or you can suspend it at the time of retirement. You have a retirement date that is within 120 days from the date you leave UC employment. You continue your coverage until the date your retirement income begins. Now, if you are considering taking a lump sum cash out, one thing you do want to consider is that you do forfeit your eligibility for retiree health benefits. Now, this is typically for those folks who this might be the best option for them, but if you are considering the lump sum cash out, please note that you do forfeit your eligibility for retiree health insurance. There are 3 retiree health insurance groups with different UCRP entry dates. The retiree health insurance group you are in determines how your eligibility and costs for retiree health insurance is calculated. We will explore these groups further in the plan options and premium sections. Now let's take a look at frequently asked questions. When does retiree insurance start? If you separate in June with a July 1 retirement date, then your UCSB health insurance coverage ends July 31st. That means your UC retiree health plan and Medicare, if you're eligible, start effective August 1st. What happens to my family when I enroll in Medicare? For your non-Medicare eligible family members, they will remain in their current medical plan, with the exception of the health savings plan. For your Medicare eligible family members, they will enroll in Medicare and then enroll in a UC Medicare plan. When may I change plans? So retirement alone is not a qualifying event to change plans. That means your opportunity to make changes would be annually during open enrollment, which takes place typically in the fall, or if you move and you move outside of a UC service area. If I suspend, when can I re-enroll? If you suspend your retiree health insurance because you have other coverage elsewhere, you may re-enroll during open enrollment or if you experience involuntary loss of coverage. Do dental and vision continue? Delta Dental Insurance continues with the UC contribution, whereas the retiree vision insurance, which is administered through VSP, is optional. So if it's something that you do decide to continue, you must elect it at the time of retirement, and then you pay the premiums directly to VSP. The Delta PPO and Delta Care USA HMO plans are coverage remains the same at retirement, so those would be your dental plan options. Now, if you're eligible for the maximum UC contribution, your premiums are paid in full for dental by the UC. If you're not eligible for the maximum UC contribution, then you are subject to graduated eligibility, which means you would pay a percentage for the Delta insurance. For vision insurance, again, as I mentioned earlier, this plan is optional, so if it's something that you decide to elect at retirement, you pay the premiums directly to VSP. The plan does offer worldwide coverage, and you can find the rates on UCNet. Are you moving or thinking about moving? For the UC Medicare Choice, Kaiser, and High Options plans, you must live in California or a California service area. If you move outside of California but remain in the US, then UC Care and Core would be your options. The Health Savings Plan will also be available for retirees who enrolled in this plan prior to their retirement and are not yet Medicare eligible. The UC Medicare PPO plan is available for split families only. This means that you have some family members who are eligible for Medicare and some who are not. If all your family members are eligible for Medicare and you live outside of California, then you and your family would elect a plan through the UC Medicare Coordinator Program administered by VIA Benefits. We will take a closer look at this in the next slide. As mentioned in the previous slide, if you're living outside of California but in the US and all family members are eligible for Medicare, then you and your family will be moved to the UC Medicare Coordinator Program administered by VIA Benefits. For retirees eligible for the maximum UC contribution toward retiree health insurance, will receive a $3,000 contribution toward a health reimbursement account for each member. This contribution is subject to graduated eligibility, so if you're not eligible for the maximum UC contribution, then you will get a percentage of the $3,000 contribution. You can then use these funds to purchase an individual Medicare health plan and Part D through VIA Benefits. Any unused HRA funds will roll over to the next year. RASC sends a monthly file feed of retirees over 65 and living outside of California to VIA Benefits. Once VIA Benefits gets this file, a VIA Benefits counselor will reach out to you directly and assist you in finding a Medicare health plan and Part D plan that best meets your needs in the area you live. What if I'm thinking about moving outside of the US? What's available for me if I move outside of the US? So of course, as many of you know, Medicare is a federal program, so you do not have international coverage through Medicare. So if you're planning on living outside of the US, your plan options at retirement would be the UC Care PPO or Core. Both of these plans offer international coverage. Plan options. Each UC medical plan has a Medicare version. So you can see on the left-hand side, the non-Medicare plans are the same as your active employee plans. For example, UC Blue and Gold HMO, Kaiser HMO, UC Care, Core, Health Savings Plan are all plan options as an active employee. These are considered our non-Medicare plans. Each of these plans then have a partner Medicare plan when you retire and become Medicare eligible. That means if you're enrolled in the UC Blue and Gold HMO, you automatically transition to the UC Medicare Choice. Kaiser HMO, you automatically transition to Kaiser Senior Advantage. And of course, the Anthem PPO plans, you automatically transition to the UC Medicare PPO. When a family has both non-Medicare and Medicare members, then the non-Medicare members will remain in the current non-Medicare plan, whereas the Medicare eligible family members will transition to the Medicare plan. So if you have some family members who are not yet 65, they will, for example, remain in UC Blue and Gold HMO, while your Medicare eligible family members will transition to UC Medicare Choice. This is what we refer to as split families. As a side note, the UC Health Savings Plan is not available to split families. So if you're enrolled in the Health Savings Plan and you have a family member who's becoming Medicare eligible, then you would transition to the UC Care Core and the Medicare PPO option. Now let's take a look at how UC retiree health insurance premiums are calculated. Each year, the UC determines the maximum contribution paid towards retiree medical and dental premiums. The maximum contribution does not mean that the UC pays retiree health insurance in full, but the retirees are eligible for the maximum amount UC pays towards retiree health insurance. That said, some retirees are eligible for the maximum UC contribution, and others may have graduated eligibility, which means they receive a percentage of the UC contribution amount. As I introduced at the beginning of this video, which entry group you are in, along with years of service, determine whether you will be eligible for the maximum UC contribution toward retiree health insurance or graduated eligibility. For folks in Group 1 with an entry or re-entry date prior to January 1st, 1990, who have 20 years of UCRP service credit and no break in service, are eligible for 100% the UC contribution amount. For folks in Group 2 with an entry or re-entry date on or after January 1st, 1990 through June 30th of 2013, with 20 years of UCRP service credit and no break in service, will also be eligible for 100% the UC contribution amount. Those folks in Group 2 who have at least 10 years of UCRP service credit or their age and their service credit equals 75 will have graduated eligibility, again, which is they will receive a percentage of the UC contribution amount. Finally, for folks in Group 3 with an entry or re-entry date on or after July 1st, 2013 to present, who are 65 years old with 20 years of UCRP service credit will be eligible for 100% the UC contribution toward retiree health. If you have a minimum of 10 years service credit and retire at age 56 or older, then you will have graduated eligibility, which can range anywhere between 0% to 100% and is calculated by your age and service credit. If you're eligible for the maximum UC contribution, you can find these rates on UCNet under Retiree Medical Plan Costs 2021. The maximum contribution rate chart on UCNet is broken into 4 categories. You'll want to research the category that you and your family belong to determine your UC premium. For folks with graduated eligibility, RASC will calculate your premium based on your age and years of service credit. You can find additional information in the Retirement Handbook on UCNet. Now let's take a closer look at Medicare and how Medicare and UC plans work together. Medicare is a federal program that provides medical insurance for people 65 or older, people with disabilities, or special medical conditions. Medicare covers most medical services but does not pay total cost of care, and it serves as the foundation for all UC Medicare plans. The University of California requires all retirees and family members to enroll in Medicare if eligible. Coordinating your UC medical plan with Medicare does help sustain the retiree health program. Now, of course, there isn't the exception that if you live outside the USA, you are not required to enroll in Medicare. Again, because this is a federal program, so your options would be UC Care PPO or CORE. Who is eligible for Medicare is based on your own work history or the work history of your spouse or former spouse. So I always encourage people to contact Social Security directly if you have questions about eligibility or to enroll. Medicare starts the first day of the month in which you turn 65. With the exception that if your birthday lands on the first of the month, then Medicare starts the first of the prior month. For example, if your birthday is February 1st, then your Medicare start date would be January 1st. Applying for Medicare is easy. First, you apply for Medicare Part A and B. Next, you'll complete the appropriate UC enrollment form to transition from the non-Medicare plan to the UC Medicare plan. And finally, you would inform and give your doctor your Medicare card and UC Medicare ID card at your next office visit. Let's take a look at the different parts of Medicare. Part A provides partial coverage for hospital stays, skilled nursing, and hospice care. Part B provides partial coverage for office visits, labs, and medical equipment, and Part D covers prescription drugs. Now, I'm sure you noticed I skipped Part C. Part C is the name used for Medicare Advantage plans. Under a Medicare Advantage plan, you assign your Medicare over to a private insurance provider, and they manage your healthcare needs on behalf of Medicare. Part C Medicare Advantage plans generally combine coverage for Part A, Part B, and Part D. The UC offers two Medicare Advantage Part C plans, UC Medicare Choice and Kaiser Senior Advantage. Medicare reviews your modified adjusted gross income reported on your IRS tax return from 2 years ago to determine your Medicare premium. So this year, Medicare will be reviewing your 2019 tax return to determine your 2021 Medicare premium. There is no monthly premium for enrollment in Part A, and the Part B premium for 2021 for most will be $148.50. If you made more than $88,000 as a single person or $176,000 jointly, you'll pay the standard premium amount and what's called an income-related monthly adjustment amount, IRMA, which is an extra charge added to your Part B and Part D premiums. You have separate Medicare and UC premiums. Your Medicare Part B and if you have a higher income Part D premiums will be deducted directly from your Social Security check. If you're not yet receiving your Social Security benefit, then your Medicare premiums will be billed to you directly in 3-month increments, whereas your UC medical and dental premiums will be deducted monthly from your UC pension check. Since vision is optional, if you continue vision, you will pay your premiums directly to VSP. Now let's explore the cost of medical care. So Medicare and the UC plan pays most of your medical expenses. They work together. Each of the plans may have different benefits, costs, medical providers, service area, behavioral health providers, and enrollment and de-enrollment processes. The UC offers two Medicare Advantage plans, UC Medicare Choice and Kaiser Senior Advantage. The UC Medicare Choice is a PPO Advantage plan. This means you assign your Medicare to the insurance plan and your providers bill the insurance directly. Under the UC Medicare Choice PPO Advantage Plan, referrals are not required. Under Kaiser Senior Advantage HMO, you assign your Medicare to the insurance plan, your provider bills your insurance directly, and you cannot use Medicare outside the plan. PCPs and referrals are required under the Kaiser Senior Advantage Plan. Since the UC Medicare Choice is a PPO Advantage plan, it is administered by United Healthcare, and you do not need to assign a primary care physician. You also do not need referrals for specialists, and you may use United Healthcare doctors or Medicare doctors who accept Medicare assignment and are willing to bill United Healthcare. Under the Kaiser Senior Advantage HMO plan, you have to select a primary care physician who is part of the medical group. Your primary care physician is going to coordinate your care. They're also going to refer you to specialists, and your specialists are going to be limited to the medical group. Under the UC Medicare Choice and Kaiser Senior Advantage plans, you pay co-pays for care and you do not have a deductible. This way, you know exactly what you're going to pay for each service, and there are no surprises. In addition to the UC Medicare Choice and Kaiser Senior Advantage plans, the UC offers 3 supplement to Medicare plans: UC Medicare PPO, UC Medicare PPO without prescription, and UC High Option. Now, the UC Medicare PPO without prescription is the exact same medical plan design as the UC Medicare PPO, with the exception that it does not include prescription drug coverage. Since these plans are supplements to Medicare, Medicare is the primary insurance, and the UC Medicare PPO and the high option plans are secondary. Under these plans, you have an annual deductible, and you will pay a coinsurance after Medicare. Again, under the UC Medicare supplement plans, Medicare is the primary and Anthem is the secondary. Therefore, whenever you need to see a doctor, you must visit Medicare providers for Medicare services. And you can visit Anthem or non-Anthem providers for additional services. In the next few slides, we will explore examples of coordination of benefits and coinsurance breakdown between Medicare and the UC supplement plans. In this example, in this office visit example, Medicare's allowable amount for an office visit is $150. Since Medicare is the primary insurance, they will pay 80% of their allowed amount. Anthem will then cover 80% after Medicare under the UC Medicare PPO plan and 100% after Medicare under the high option plan. In this hospital example, the Medicare Part A deductible is $1,484. Anthem pays the full Part A deductible for both the Medicare PPO and high option PPO plan. In this example, the first 20 days of skilled nursing are paid in full by Medicare. Then from the 21st to 100th day, the rate is $185.50. For days 21 through 100, Anthem will pay 80% under the UC Medicare PPO plan and 100% under the high option plan. Each of the UC retiree health insurance plans offer mental care and substance abuse treatment. Coverage and provider networks differ. Behavioral health coverage and providers for the non-Medicare plans are the same as the UC employee plans, whereas the behavioral health provider changes once you transition to a UC Medicare plan. Now let's take a look at prescription drug coverage under the UC plans. The Medicare Part D is bundled with all the UC Medicare plans with the exception of the UC Medicare PPO without prescription drugs. You pay co-pays for prescriptions, and some formulary lists will change depending on which plan you're in. Here you can see the difference in co-pays between the Medicare Choice and the Medicare PPO and high option plans. If you'd like to see the cost for the Kaiser Senior Advantage plan, please visit the plan documents on UCNet for additional information. All of the UC Medicare prescription drug plans, so each of the medical plans that the UC offers have a bundled Part D prescription drug plan, of course, with the exception of the UC Medicare PPO without prescription drugs. Each of these drug plans also have a prescription maximum. That means once you hit this prescription maximum in the plan year, the plan will pay 100% of the cost for the rest of the year. If you're interested in the UC Medicare PPO without prescription drug plan, this plan might be a good fit for retirees with graduated eligibility who may want to consider this plan to help reduce their out-of-pocket costs, or if you have less than a certain number of years of UCRP service credit. One thing to know is that Medicare allows you to only have one Part D drug plan. You may enroll in this plan, but if you do, you must enroll in a non-UC Part D drug plan. You then have to supply proof of this coverage to the UC in order to avoid penalty. If you're thinking of traveling outside of the US, there's some things you should keep in mind depending on which plan you're enrolled in, what your coverage is going to look like. So under the Kaiser Senior Advantage, you will be covered for emergency and urgent care only. Under the UC Medicare Choice, you'll be covered for emergency, urgent care, and routine care. Under the UC Medicare PPO and the UC High option plans, you do have to meet your annual deductible, and after that, Anthem will pay 80% and you pay 20%. When you enroll in Medicare will depend on whether you are still an active working employee, retiring and turning 65, or retired and turning 65. Employees who become eligible for Medicare may enroll in Part A when first eligible, but you are not required to do so. If you enroll in Part A, you do not enroll in Medicare's Part B or D. If your spouse is covered under your UC medical plan, they can also have the option to enroll in Part A or defer their enrollments in Part A and B until your retirement. You will have a special enrollment period at retirement. For those employees who are enrolled in the health savings plan, they must delay their enrollment in Medicare A, B, and D until retirement. Please note, if you are drawing a Social Security pension, you will automatically be enrolled in Part A at age 65, and if you are, you cannot contribute to your HSA. For domestic partners, I encourage you to consult a Social Security about when to apply for Medicare, because you may not, your domestic partner may not have a special enrollment period while enrolled in your employee plan. If you're eligible for Medicare at retirement, you will apply for Medicare's Part A and B. You can enroll online or call the Social Security office 2 months before your UC employee retirement date. RASC will then send you forms. One of them will be the request for employment information, and the other one will be your UC Medicare transition form. If you become eligible for Medicare after retirement, then you will want to apply for Medicare's Part A and B about 3 months before your 65th birthday. You can apply for Medicare A and B online through the Social Security website or by contacting our local Social Security office. If you are receiving your Social Security pension, you will automatically be enrolled in Medicare's Part A and B, so you don't have to do anything. However, if you are not receiving your Social Security pension, then you will have to take that initiative to enroll in Social Security. RASC will then mail you and your eligible family members the UC forms to transition from the non-UC Medicare plans to a UC Medicare plan. So these are the forms that will be required once you transition from the non-UC Medicare plans to the Medicare plans. If you are turning 65 and you're enrolled in UC Blue and Gold HMO, you will need to complete the UBIN 121, and that is the partner Medicare plan. The UC Medicare Choice is the partner Medicare plan of the UC Blue and Gold HMO plan. If you're enrolled in UC Care, Health Savings Plan, or Core, then you will need to complete UBIN 123, and that is to transition to the UC Medicare PPO plan. If you are enrolled in the Kaiser HMO, you will need to complete the Kaiser Senior Advantage UBIN 127 form to transition to Kaiser Senior Advantage. Once you've completed your UC forms, you will want to submit them either by faxing them or sending them via your secure email on your UC Raise account. Of course, if you ever have any questions, you're always more than welcome to reach out to me directly, and I'm happy to help assist you through the process. Let's review the timeline of events that will occur for those individuals transitioning to Medicare during or after retirement. First, you apply for Medicare's Part A and B with Social Security. Social Security confirms your enrollment. You then send your UC form to RASC. RASC and the insurance will update your plan. The insurance will enroll you in Part D. Your insurance sends you your new ID cards, and then you inform your providers of your new plan. For those folks who are thinking about returning to the UC after retirement, just some things to consider that returning to work can impact how your medical plan coordinates with Medicare. So I do encourage you to review the Returning to UC Employment After Retirement fact sheet, which can be found on UCNet. For those of you who aren't interested in coming back to work, but are interested in staying connected to the campus, I strongly encourage you to visit the Emeriti and Retiree Associations. Karen Rasmussen is the Emeriti and Retiree Coordinator, and she sends out monthly newsletters and details of any upcoming local events. If you're interested in becoming a member or being added to her email list, please contact her directly. Thank you so much for joining.